adage, health is wealth, is true of the human anatomy and physiology. A little discomfort to the body affects the physical and emotional state of man. With science and technology, care for health challenges is easier in treatment and faster in recovery time, oftentimes at a cost in financing. For many, this price is often too high to pay in real terms. To tackle such impediments to quality healthcare, the federal government established the National Health Insurance Scheme, now National Health Insurance Authority. This scheme is in no small means helping to provide access to quality and affordable healthcare for many Nigerians. Yet many say there is still room for improvement in coverage areas to give peculiar access to people with peculiar health needs. This is our focus on this edition of Dateline 360. I am Omotola Omojola, and it is good to have you join us. So what is the National Health Insurance Authority all about? How well has the agency fared in delivering on its mandate? What is missing and what can be improved upon to provide inclusion for those with special healthcare needs? Uche Ogochukwu has answers to these and more.
In 1999, Nigeria floated a National Health Insurance Scheme, NHIS, by Decree 35 to provide accessible, affordable and quality healthcare services for its populace. The scheme recorded success with limitations, and the need for improvement resulted in the amendment in 2004. But this was not void of challenges.
Any challenge, sometimes they will tell you that you should wait. Like me now, since yesterday, I'm here because they are telling me that I should wait for them to give them a code.
The only issue is about maybe the drugs. Some of the drugs are not being covered, or the quality of the drugs they give you.
To address these and several other weaknesses, the federal government in 2022 repealed the NHIS Act and established the National Health Insurance Authority, NHIA.
The NHIA Act has made health insurance mandatory for all Nigerians and legal residents. So there are two major aspects of that act. It's mandatory for all Nigerians, and then the establishment of the Vulnerable Group Fund, which will enable the NHIA to be able to bring on board those Nigerians that are vulnerable and won't be able to pay for their health insurance.
By this, over 70% of Nigerians who pay for healthcare out of pocket will be alleviated from poverty.
We are doing everything through accreditation, quality assurance, to ensure that the best quality of care is provided for the NHIA enrollees. And that is to say that the standards of drugs that are dispensed under the NHIA are of the best possible qualities.
Looking at Cancer Health Fund, the CHF, they've also tried. At least they've been able to alleviate or save a number of people's life, because those drugs are quite expensive, and sourcing for the drugs and looking for money health care is also reduced.
With the Medicine Supply Initiative, reduction of intravenous fluid by 50%, and the 2023 operational guidelines, among others, there are new improvements, but much more needs to be done.
The problem is the crowd. They come in, they have to be in batches. So if the fund is available, we are ready to take to the next level.
We will say that we enjoy it, because at a point you can come to a hospital, you don't have money, but because of the NHIS, cover some drugs, cover, like now my wife is going for CS.
The experiences of some beneficiaries indicates that such hopes will be realized if current concerns are addressed to build public confidence and get more Nigerians enrolled in the scheme. This way, actors say governments hope to increase and improve healthcare services to meet the universal health coverage targets. Uche Ogochukwu Reporting for Dateline 360.
Thanks, Uche, for that package. For the health insurance scheme to function efficiently, health maintenance organizations are essential to the achievement of universal health coverage. They exist to serve as go-betweens among the insurance authority, the hospitals and patients to ensure that due diligence is observed in healthcare delivery to all patients. Hakimat Aliyu inquires to know if indeed this important bridge between affordable, reliable access to quality healthcare and patients have been connecting for building a healthy population.
Health insurance is now mandatory as contained in the National Health Insurance Act enacted in 2022. The National Health Insurance Bill also provides for all states of the Federation to domesticate the health insurance scheme. In the nation's capital, through the FCT Health Insurance Scheme, the FCT administration is keen on ensuring every resident is enrolled.
I'm happy that there's a National Health Insurance Scheme, which means the country as a whole understands the essence of health insurance. In trying to increase the uptake of health insurance in the FCT, we are looking at the whole value chain. One, ensuring there's human resource in health to offer quality health care. Secondly, the medication you need to take care of you, as long as that disease we are diagnosing or what we are taking off is part of your package. We have realized that we have gotten reports that most times they ask us to go and buy, they ask us the rights, and this is not encouraging. This will not give us the outcomes that we want. So we're looking at the value chain, digitalizing our processes, medical records, drug revolving fund, and the health insurance scheme.
Health insurance as a global phenomenon is regarded a necessity to protect families from financial hardship of out-of-pocket expenditure on healthcare services. The scheme ensures equitable distribution of healthcare costs amongst different income groups. To maintain high standards of healthcare delivery services, health maintenance organizations HMOs licensed by the National Health Insurance Authority are saddled with the responsibility of ensuring access to quality health care services for enrollees using various health institutions.
You must regularly do what we call quality assurance. Quality assurance is you visit the hospital, you go there, they check the folders, make sure that the hospitals, we call them providers, are giving the stipulated treatments according to the treatment protocol of NHI. That's the guideline.
An employer who is satisfied with a health plan meant to be provided for its employees by a particular HMO pays once an agreement has been reached.
At the Garki Hospital, one of the 14 district hospitals in the nation's capital, Abuja, and here, over 50% of their patients are covered under the National Health Insurance Scheme, NHIS, now NHIA.
I enrolled with Novo. Novo is my HMO.
So what's your experience like?
My experience with them is that they are not doing exactly what they promised us.
There are some days that things go well, and there are other days that when you come, you have to wait for so long before they will attend to you.
Like the last experience I had was the day they admitted my son. We were discharged in the morning. Before we got approval for us to make the normal payment, it took us almost the whole day. I made a call, and it was after my call that it was approved. So like now I'm waiting for approval. I called my HMO. They said the request has not gotten to them.
At FMC Jabi, I also sought to find out the situation.
Before, when the process was manual, it was quite a long wait.
It's not all of the HMO that causes delay. So others ones are prompt in terms of providing a code easily.
Constantly monitor our HMOs. The hospitals, the government hospitals, the hospitals empaneled have to ensure it is our responsibility to ensure that there is medication and there is qualitative health care available.
There are more than 70 accredited HMOs registered nationwide. Findings, however, reveal that inadequate manpower and facilities to fast-track the process on both parts of health maintenance organizations and healthcare providers are leading challenges that need to be urgently addressed to ease the process.
Well, while the tales of frustration continues from government employees enrolled under the scheme, many say the work is on the regulatory body, NHIA, to checkmate the activities of the HMOs that are not prompt to responding to requests to fast-track access to care for patients. In Abuja, Hakimat Aliu reporting for Dateline 360.
While many Nigerians have been benefiting from the health insurance scheme for more than a decade now, Joy Ubani from Uyo in Akwa Ibom State reports that the scheme is yet to be functional at a state level, as there are no enrollees under the state scheme. Her interactions with Uyo residents, however, reveal efficiency concerns in service delivery at some of the health facilities.
In Uyo, the Akwa Ibom State Coordinator, the National Health Insurance Authority, Ebiokobo Williams, is commending the state government for establishing its own state health insurance agency to cater for the health needs of the people.
Really, we encourage states to start small. Sometimes, when states design their benefit packages, they want to include, any and every ailment, which is not right, because every state has its own peculiar disease burden. That's clear. So you need to identify that first, and then there are a few other regular ailments that we have in our climate. So you put all those ones into the package. Then, most importantly, to design a for very good package, you must engage an actuary. Who's an actuary? The person that used statistical data to arrive at the cost component for treating certain ailments, and of course, you now have, with that, you can do an aggregate and say, it will cost us X amount for any enrollee to come in. So that will inform the amount you have as your premium that anybody can.
Mr. Williams also says the process is, however, not without challenges, and one of it is the belief that generic drugs are substandard when compared to branded drugs.
Life is all about challenges and overcoming those challenges. So we can speak to things like maybe challenges from the healthcare facilities angle, challenges with our sister, with the other partners we work with, the health maintenance organizations. Then, of course, we can, challenges in-house, you understand, maybe from the ministry, department, and agencies, you understand, where we could have people not having a proper understanding of how the system works. And then, the way they approach it can lead to a challenge within our own system also. So I can say, yes, there are challenges, but of course we are working around the clock to overcome them. I want to speak to that. I will just talk about recently we've had cases of maybe people having to say, certain drugs that they got at hospitals are not effective enough or something like that. So we had to now, to overcome that, we have come up with a program called the NHI Medicine Supply Initiative, where we have engaged 12 pharmaceutical companies. We signed an MOU with them and all that to produce certain, should I say, commonly used drugs. I think they're 33 in number, 33 formulations that we put together. And so they will produce those drugs and then have them branded NHI.
Meanwhile, Executive Secretary of Akwa Ibom State Health Insurance Agency, Dr. Igbemi Acto, says the state government is ready to have all-inclusive health insurance scheme.
The process is still on, but I can tell you that we've gone far. The last group to join was the team, the Standard and Quality Assurance team. We've gotten a good number of them. long as you are living in Akwa Ibom State, you are doing something here, you are contributing to the economy of Akwa Ibom State. So our law captures you, say, every resident.
Some beneficiaries share their experiences with Dateline 360 on the services of NHIA.
Poor. They hardly approve any drugs. Even if you drink malaria drugs, that one can easily walk, across the counter, pay for. They say it's not covered. Even when they eventually say it's covered, they probably will just cover 20%, 30%, and the patient pays for the rest.
From the drug issue, quite a number of drugs they said is not covered by NHIS.
If we maintain NHIA, there must be a different story. That our doctor and nurse will carry us along in case of emergency, they treat us well.
Statistics reveal that about 95% ill health conditions afflicting Nigerians are covered by National Health Insurance Scheme, now known as National Health Insurance Authority. Many are ignorant of this development. However, NHIA says it making its services more accessible and affordable for all Nigerians in the private sector and public sector to achieve universal coverage. Joy Ubani for Dateline 360.
Achieving universal health coverage is one sure way to providing accessible and affordable health insurance and reducing out-of-pocket expenditure. Bulak Afsa brings us the Bauchi State experience.
The scheme has three sectors: the formal, informal, and vulnerable program, although the formal is yet to commence. Salim Laden Yorima is a 19-year-old living positive. He has been accessing care from the scheme. Al-Qasim Yakubi is also a sickle cell client whose life, he said, has changed since he started accessing care at no cost under the scheme. The story is the same with Abubakar Ali Tata, who is living with disability.
This hospital, you can give me medicine. I'm drinking medicine. I do not give money. You can come and give me medicine and septrin and go out and eat and drink the medicine.
Ashma took 250,000 people, which they help with medical care. Even when there is a need for blood transfusion, they donate for free. I've been a beneficiary for 2 years, and we have been receiving adequate care.
Executive Secretary of the agency, Dr. Mansur Dada, called on government at all levels to increase funds so that the coverage of the poor and vulnerable will be expanded. Despite the achievements of the agency, there are challenges that needs to be addressed if universal health coverage is to be achieved, thereby reducing out-of-pocket spending. Because according to the National Bureau for Statistics, 70% of indigents of Bauchi State are classified as poor and vulnerable, living below the poverty line.
The state government, civil society organizations, and Bashma, we need to push hard so that the state government public sector program will also commence. When it commences, it means a lot. 7,000 workers on the side of the state government and 50,000 workers with a spouse and 4 dependents. That means we are targeting almost 400,000, and it means a lot. The coverage of the poor and the vulnerable. Right now, what we have is less than 100,000. We need to have more lives, more money for the coverage of more lives. So what that means is that the government at the federal, state, and the local government, they have to come up with a lot of innovations so that we can have more funds.
On their part, the health workers in the facilities pleaded that the program should be expanded to accommodate more clients and adequate human resource provided. In Bauchi, Bulak Afsa.
And And from Akure, Ifeoluwa Moshule examines the Ondo State Contributory Health Commission towards enhancing healthcare delivery in the state.
Expensive medical costs is the reason many people settle for self-medication, which poses a risk to their well-being. Over the years, different health interventions have begun to emerge both at the state and federal levels in a bid to make healthcare services accessible to all, and Ondo State government is not left out. This is the office of the Ondo State Contributory Health Commission, created to ease the burden of healthcare on residents of the state. It is noteworthy to state that there are 3 programs under the scheme, and some of these programs are open to all and sundry, irrespective of status or class.
Yeah, we have a special program called the Basic Healthcare Provision Fund Program, which we have tagged the Lera Loro scheme, collaboration between federal government and state government. Shortly after, the Basic Healthcare Provision Fund Program was also launched in 2021, and that caters for the clusters of people the federal government made provision for. Vulnerables in our midst also, elderly widows, women of reproductive age group, pregnant women, children under 5, people with disabilities. Those are safety nets model, where it's government that provide the premium and the beneficiaries do not pay a dime for covered services in all the accredited centers.
This is 52 years old Samuel Kwaye, a Ghanaian residing in the Sunshine State, who underwent hernia surgery a few months ago under a Lera Loro health insurance scheme without any financial implication.
I did hernia surgery, but I didn't pay anything. I feel pain. Well, I don't know how to do, but as they discover, they carry me go hospital. Now they know say I get hernia. The process is not stressful. Those state health insurance, they help me. I didn't pay anything.
Another beneficiary of the Abiamo health insurance scheme is a 34-year-old Toyin Ofuafon, who put to bed without any payment.
Like when I gave birth to my baby, I didn't pay a dime. The only thing I bought were the disposables that the hospitals will not provide naturally. So
the State Contributory Health Commission has over 154,817 enrollees, 37,814 equity scheme beneficiaries, and 232 care centers spread across all the wards and local government areas of the state. Residents applauded the efforts of the state government while expressing optimism that the standard of the scheme will be maintained. In Akure, Ifeoluwa Moshule reporting for Dateline 360.
And with that package by Ifeoluwa, we conclude this edition of Dateline 360. We hope that concerned stakeholders in the health insurance scheme will take action that benefits all and also promote universal health coverage. I am Omotola Omojola, and on behalf of the production crew, I thank you for your company. May God bless Nigeria.